Hello. In this video, we will be showing you how to take your blood pressure using your at-home blood pressure cuff, how to choose which arm to take your blood pressure from, how to prepare before taking your blood pressure in order to obtain an accurate reading, as well as how to choose the correct size blood pressure cuff that you will need. For more information, please read the insert provided with your blood pressure cuff or speak with your healthcare provider.
So how do you choose which arm to take your blood pressure from? So the very first time you take your blood pressure from home, just take it from both arms, and then whichever one had the higher blood pressure reading is the one that you should use from then on at home. To get the most accurate reading, avoid exercise, tobacco, and caffeine at least 30 minutes before you take your blood pressure reading. Make sure you also empty your bladder as well before you take your blood pressure reading. Take your blood pressure before you start to take any of your heart medications for that day. And if you've been given any other instructions to follow from your healthcare provider that provided you with the blood pressure cuff, make sure to follow those as well. A couple final points about taking your blood pressure from home. Find somewhere that you can rest quietly for about 5 minutes, a chair that supports your backbone that you can sit up straight, and keep your legs uncrossed and your feet flat on the floor. Take your blood pressure over a bare arm and not over a sleeve. And when you're using your blood pressure machine, keep your arm at heart level by resting it on a table, for example, and that will let you get the most accurate blood pressure reading.
Put your arm through the blood pressure cuff as shown in the video. The bottom edge of the cuff should be 1 to 2 centimeters or 3/4 of an inch above your elbow, and the brachial artery mark lined up with the center of your inner arm. Tighten it so that it is snug but not very uncomfortable. Press the on button. The cuff will start to tighten. It is set to automatically stop when it is tight enough, and then will slowly deflate. When it is complete, you will hear a beep. When the machine starts tightening, you can stop it immediately if the cuffs start to get uncomfortable. To do this, you can press the off button as shown in the video, and it will deflate. Once the machine has finished, it will beep and release completely and show your final numbers on the screen. Record the top number, called the systolic blood pressure, the middle number, called the diastolic blood pressure, and your heart rate, which is the bottom number besides pulse. Repeat this process. Take your blood pressure twice with 1 minute of waiting time in between. This may seem tedious, but it will make sure you get the best accuracy you can from home.
Your healthcare team may ask you to measure your arm to know which blood pressure cuff size you need. You can do this at home. Find a measuring tape. First, measure the distance from your shoulder bone to the tip of your elbow. You can divide the number you get in half. That is the halfway point between your shoulder and your elbow. This is where you should measure the circumference of your arm. That is, all the way around your arm.